Okay, so a little speed update on the new curriculum and the exams. This is very much biased towards the higher trainees. So you will all be aware that there's a new portfolio system called Kaizen and that there is a new curriculum. It's much more trainee-led than previously, and it is much less of a tick box exercise, which can only be a good thing. There are 8 clinical specialty learning outcomes based around the 8 different areas of emergency medicine, including trauma, critically unwell patients, paediatrics, etc., etc. Nothing that will be of a surprise to you. So every time a trainee sees a patient or has any sort of clinical encounter with something that they think would be useful to get an assessment on, they will match it to one or more of the specialty learning outcomes, and then they will send you a form to fill in. You will mark that according to an entrustment scale, which I'll speak about in the other video that I'm going to do. It's very intuitive, very straightforward, and hopefully will feel much easier than it did previously. As well as gaining assessments towards the clinical specialty learning outcomes, they will also have to get evidence towards the generic specialty learning outcomes, which are akin to the common competencies of old. So these fall under the categories of education and teaching, leadership, quality improvement and research. And they will be seeking to gain evidence in all of these domains over the course of their training. There are lots of new forms to help them do that, and again I'll talk about a little bit about those on the other video that I'm going to do. So exam wise, the final OSCE is still in. It is the plan is to go back to face-to-face. There will be 16 stations of 8 minutes each, so that hasn't changed very much. And that will be broken up into complex stable patients. There'll be 3 of those. Epic, stations looking at performance in the emergency physician in charge of the department role. So that's new. There will also be a station on some sort of supervision or teaching. There will be 3 resus stations, but they will all be single stations, so the double stations have gone. There'll be 1 on paediatric emergency medicine and 2 on some sort of injury. There's an increasing emphasis on leadership and management, as indicated above, and there will be 2 to 4 stations which have a predominant management component. The marking will be much more based on examiner judgment than it was previously. You are allowed to take your OSCE after 12 months of higher training, so you can do that as early as the beginning of ST5. Trainees are allowed to have 4 attempts to pass successfully, and as I've said above, it will be domain-based marking rather than checklist type marking, and much more based on examiner judgment. So again, I think those are all positive moves in the right direction. Critical appraisal exam has gone. The trainees will need to evidence critical appraisal activity throughout their training, however. So they will need to do appropriate RChem learning modules. They'll need to do local and regional training in a critical appraisal. Journal clubs are very much back in, and they will also need to do sort of shop floor initiated critical appraisal. So a patient that they're not sure what to do with, what the evidence base is behind, they are encouraged to go away and do a little bit of a literature search and an appraisal of the literature to answer that clinical question. And as supervisors, you will be expected to mark the forms that they submit when they've done such exercises. So that's a new one for them and for us. Their SAQ is now a single best answer question. They've done a lot of research and they think it's going to be just as reliable as the SAQ in terms of assessing capability at the end of training. It's obviously a form of multiple choice with only one correct answer, and that has huge positive implications for the college in that they can now get it marked by a computer rather than a whole host of examiners. So that's the rationale behind doing that. But again, that is new, and we will learn more about that in due course. Within that exam, they will include management, sort of leadership, research and QI type questions, so it won't just be clinically based as it was. And I think that is it for me on the curriculum and exams.